How's everybody? Good morning. So we're, good morning, everybody. Good. So we're getting ready to move into this comprehensive traffic safety campaign. And so I have our Department of Transportation Director here, Michelle Pouchot, and we're going to talk about the various partners that are engaged with us on this. And as I've always said, collaboration, collaboration, collaboration. We're working with the Baltimore City Police Department, the Fire Department, our Bicycle Advisory Commission, Bike More, and the Downtown Partnership. All of you are important. The Maryland Department of Transportation is here, and AAA, because whether you all know it or not, most of the street accidents that occur in our state, 32% occur right here in Baltimore City. And that is a problem. 32% of all statewide pedestrian-involved crashes occur right here in the city of Baltimore. And we believe that we can decrease that. And when we talk about public safety, this is certainly one of those areas. So I'm going to turn it over to our director.
Thank you.
Michelle.
Thank you, Madam Mayor. Good morning, everyone.
Good morning.
Thanks for coming out for this important announcement today. And thank you, Mayor Pugh, for allowing us this time. I want to share with you first that I want to thank our partners specifically. We have Jason Ridgway, who's the Deputy Administrator and Chief Engineer of Maryland Department of Transportation, State Highway Administration. We also have Regina Avarella from AAA, the Mid-Atlantic region. Thanks for coming out, Regina. We've got Sergeant Paul McMillan, a very important partner from the Baltimore Police Department, and he helps us with all of our traffic enforcement areas. And we also have Chief John Blake, who's from the Fire Department, so thanks for being here. But I also want to announce a few other partners that are here. So Bob Dingler is here from the Downtown Partnership.
Hey, Bob.
And Bob is out there. The Downtown Partnership is on the streets in the downtown helping us every day. Tony Scott is here from the Mayor's Bicycle Advisory Committee, and he is the vice chair of that committee. Thanks for being here, Tony. Luis Cardona is here, and he is representing not only the Downtown Partnership and the Mayor's Bicycle Advisory Committee, but he's also a board member of Bike More. And we've got a few more of our partners, our regional partners from the Baltimore Metropolitan Council, Todd Lang and Bola Akundi are here. And this is truly a regional and statewide effort. So our partners being with us today are important for this message. Finally, I do want to thank the people from DOT, many of who are in the room, who are carrying out the Herculean task every day of providing safety on the roads and trying to make sure that we're messaging and being proactive about safety in the city. It's our job to ensure that citizens can travel safely and efficiently in the city. This is why we're launching this comprehensive traffic safety campaign in order to reduce accidents and make our streets safer. Each year, about 20,000 crashes occur in the city, and as the mayor said, the most that occur in the state. Baltimore has consistently remained among the 5 jurisdictions in the state with high pedestrian crashes, injuries, and fatalities. But crashes can be prevented. Lives can be saved. It takes an effort to improve how we drive, walk, as well as ride. The city has aligned with our state partners here today with our Vision Zero and Zero Fatality to become a zero fatality state. With the launch of our comprehensive safety campaign, DOT will be conducting a variety of safety-related initiatives throughout the year to increase awareness about dangerous driving behavior and to provide for safe roadways. In just a few days, we're going to launch our second annual Safe City Day on Saturday, April 21st. Children of all ages and their parents are invited to join us for this free event, which teaches students about safe walking and biking habits. There will be free food giveaways, and it's at Druid Hill Park. In the month to come, we'll be launching our Don't Block the Box initiative. Traffic enforcement officers will begin issuing warning tickets to drivers who block the box at various intersections in the city. Motorists who block the box cause traffic congestion, delays, and prohibit vehicles from passing through the intersection safely. But also, it creates dangerous conditions for pedestrians and cyclists because they can't walk safely through crosswalk areas. Starting May 1st, warning tickets will be issued for don't block the box. And then when the warning period is over, motorists will receive $90 citations that include 1 point against their driver's license. We are also rolling out a new safety education campaign called Don't Be That Person to educate drivers on dangerous driving habits. In May and each subsequent month thereafter, you will see various safety messages throughout the city. I think you're seeing some of them there. Messaging will cover issues such as pedestrian and bicycle safety, speeding and red light running, seatbelt usage, and impaired driving. With these educational messages, we hope to decrease distracted driving and reduce crashes on city streets. And we're going to continue with our automated enforcement camera program in school zones and high crash intersections to help modify driver behavior. Automated enforcement, such as speed, red light, and truck enforcement cameras, are proven mechanisms for deterring dangerous driving habits. We will also be working with our local enforcement partners to target impaired, distracted, or aggressive drivers, along with Click It or Ticket seatbelt safety campaign. And like many other cities, we're moving toward zero fatalities in Baltimore and working closely with all our partners to not only enhance education, but improve engineering as well as enforcement. As the spring comes upon us, we know that walking and bicycling will be more prevalent. Children will be outside playing. Before you know it, students will be out after school and in the summertime. While this is a beautiful time of the year, it is also one of the most dangerous seasons when the highest number of vehicle crashes occur. Through our comprehensive campaign, we encourage everyone to share the road, be more aware of always putting safety first as we work towards zero in the city. Thank you for this time, and I'd like to introduce once again Jason Ridgway, our state partner. Thank you.
Thank you. Good morning. It's a pleasure to be here today with our partners in traffic safety. Thank you, Director Porchot, for that introduction. The Maryland Department of Transportation State Highway Administration is excited to be here today in support of partnership with the City of Baltimore at your traffic safety education campaign launch. Congratulations for your regional leadership in traffic safety education and being a vested partner in the state's strategic highway safety plan. This highway safety plan isn't the state, it isn't the state's, it isn't the Maryland Department of Transportation's plan, it's your plan. It's everyone's plan, it's our plan. It is a data-driven, targeted approach directing our intentional focus to 6 emphasis areas that reduce traffic crashes across the state, including here in the city of Baltimore. Towards zero deaths and Vision Zero, our goal is clear: 0 fatalities on our roadways, because 1 life loss is too many. At the Maryland Department of Transportation State Highway Administration, we manage more than 17,000 lane miles of total roadway, many of those bordering and connecting to our partners right here in the city of Baltimore. On those roads, in a blink of an eye, tragedies unfortunately can and do happen. That is why education efforts like this one, the one that you're launching today, are so critical, because following the rules of the road and, quite frankly, being courteous saves lives. During April Distracted Driving Awareness Month, we're emphasizing the message, just drive and park the phone. Particularly vulnerable to distracted drivers are pedestrians who only rarely walk away from a crash. Pedestrian crashes are on the rise across the state, with more than 100 fatalities on average each year, and they continue to be a major source of injury right here in Baltimore. In a call to action, we are continuing to look up, look out education effort, a statewide pedestrian safety campaign targeting both pedestrians and drivers alike. Featuring public service announcements, billboards, and grassroots efforts Just this past weekend, we participated in the city's landmark Light City event to emphasize how critical the visibility message for pedestrians is, and especially at night. And now it is my pleasure to introduce Regina Avarella of AAA Mid-Atlantic, another dedicated safety advocate.
Thank you. Thank you very much. Thank you, Mr. Ridgway, for that introduction. Thank you, Madam Mayor, Director Puccio. Mr. Ridgway, thank you so much for the opportunity to have AAA here to share in the announcement of Baltimore's upcoming traffic safety initiatives. The reality is we all play an important role in traffic safety on the roadways, whether we're pedestrians, truckers, motorists, bicyclists, motorcyclists, we'll be seeing more of obviously with the good weather. We all must do our part to help keep the roads safe. With April being Distracted Driving Month, this is certainly a good time to make this announcement. And unfortunately, many motorists and pedestrians are distracted on our streets and roadways. A few weeks ago, AAA's Foundation for Traffic Safety announced our annual Traffic Safety Culture Index survey, which is basically a survey that we release every year that talks about drivers' behaviors and what drivers are doing behind the road, on the roads. And unfortunately, despite the best efforts of law enforcement, transportation officials, traffic safety advocates, legislators, people are still driving distracted on our roadways. And it's not because of a lack of public awareness, and we're educating, and Mayor and DOT and SHA, everyone is doing their best, not only here in Maryland and Baltimore, but across the nation, to educate motorists about the dangers of distracted driving. And what we find over and over again is, despite the risk, we'll have, say, 88% of people saying it's very dangerous, we know how dangerous it is, but they still acknowledge that they're doing it. Sort of this do as I say, not as I do mindset, which is incredibly dangerous on our roadways. It's a disturbing trend, with almost half of all drivers surveyed reporting that they recently talked on a handheld cell phone while driving, and nearly 35% having sent a text message or an email while driving. So we know that this is a horrible, horrible trend on our roadways. And unfortunately, the number of drivers who reported using a cell phone behind the wheel has jumped 30% since 2013. So we are hopeful that initiatives such as this will help bring awareness, further educating people that, pay attention and focus on the task of driving. With more than 37,000 fatal crashes nationwide every year, it's important that we do everything we can to save more lives on our roadways. And while we often think about teenagers as being the ones who are the culprits when it comes to distracted driving, this is an everybody issue. You can go on any intersection throughout the city on any given day. I see it on the highways of 95, where somebody, instead of driving on the road, is looking at their phone. It has to stop. It really does. So on behalf of AAA, we applaud the mayor, DOT, law enforcement, all the agencies that are here, SHA of course, for what you're doing to help make our roads safe, and AAA stands with you. As a motorist and traffic safety advocate for over 110 years, we support these initiatives. Thank you very much.
Thank you. Any questions?
Yes. Could I get your name and spelling, please?
Sure, it's Regina, R-A-G-I-N-A, Cooper, C-O-O-P-E-R. Yes, ma'am.
And that
Averella, A-V-E-R-E-L-L-A.
The don't block the box, that is a law that was passed recently, is that correct?
That's correct.
And when does enforcement begin again?
May 1st, we'll begin issuing warning tickets, and then we'll be issuing warning tickets at this point for 30 days, but we'll assess where we are at the end of that period to make sure that that's the appropriate time.
And the $90 fines at the point?
Yes.
And this is for the people who enter an intersection and then the light turns red and they sit there and
Yes.
block traffic.
Yeah, so.
Like they do in Washington DC, like they do in
Yeah.
Philadelphia, like they do in New York.
Right,
Yeah.
Like they do,
statewide law.
yeah,
Right,
absolutely.
Yes.
the Traffic Safety Index Survey, is that self-reported?
No, it is a survey of, I believe, about 2,500 motorists nationwide. I can get you the link to the actual survey as well as the press release we issued late last week about it. Sure.
Madam Mayor, with police being understaffed, with them focused on crime, how is this extra enforcement of traffic laws going to happen?
Well, we do have assistance through the Department of Transportation. We have transportation police, as you well know, that are engaged as well. And so we don't think that this is taking them away from what they're normally doing. So we do have the help of the Department of Transportation. We have transportation police as well.
And the law empowers them to write these tickets, so that's a critical part of this initiative.
I saw last night on President Street around 6:30, every intersection had traffic enforcement.
Right.
Is that part of this
Yes,
with the block the box?
yes.
Right.
No, these traffic enforcement people who are already there, they cannot give tickets for someone blocking the box, is that correct? 'Cause I've seen it happen and they can't really do anything about it.
They have not been able to previously. So since the law has passed, we've been going through training, we've been practicing, and we've been waiting for this day to come to begin to issue warning tickets and to let the public know. You know, we really want people to understand it's not that we want a ticket. We want the traffic to move safely. We want pedestrians to be able to cross safely through intersections. We want bikes to travel safely. We want buses to be on time. All of this goes into just how we operate the infrastructure.
If an MTA bus were to block the box, would that bus potentially be penalized, the driver, or how would that work?
We will definitely be meeting with MTA about how we carry that out in full. That's a particular concern.
And if you recall, didn't this pass the General Assembly last year?
I believe so.
2017?
Yes.
So was there a delay in implementing it, or what was the?
No, there's no delay. We went through the winter period to, do the training, do the exercise, and we intentionally waited till the spring. We wanted to kick it off during Safety Month because the messaging, being proactive, trying to warn people ahead of time is a big part of implementing this program.
And the the traffic enforcement officers, those are paid under the police department or those are under the DOT?
I believe they're listed in the police department budget, but I'd have to finalize that for you.
Ultimately, how do you measure success?
By the reduction in the box being blocked, number one. We're working with MTA on travel time improvement. And so we've been doing a lot with signal prioritization for Transit Way. In the end, reducing crashes and fatalities is what we really want to achieve.
Do you have a projection on what kind of reduction you think the tickets will help reach in terms of people not blocking the box?
Not at this time.
Any more questions? Okay.
Thank you.
All right, thank you.
Thank you, Madam Mayor.
I was going to say, while everybody is gathering, let me also express, as I had earlier, my condolences to the Bush family for the death of Mrs. Bush, the former First Lady, a family woman who really advocated on behalf of literacy. And so just wanted to acknowledge that. Is everybody here? Great. So tomorrow we're getting ready to go into federal district court for a case against the Department of Health and Human Services for unlawfully terminating a 5-year grant for teen pregnancy prevention education after only 3 years. This would deprive over 20,000 students in Baltimore City of health education needs. We joined the lawsuit filed by the Baltimore-based nonprofit Healthy Teen Network, who is here really to explain it today. Also with Health Commissioner Dr. Leanna Nguyen, City Solicitor Andre Davis, Dr. Pat Paluzzi, Healthy Teen Network, and a representative from Democracy Forward. This is an important issue for us in the city. We think that we've done some great work, and we really wish that this work would continue. So I will now turn this over to Dr. Leanna Nguyen.
Thank you very much, Madam Mayor, and thank you to our partners and Solicitor Davis also. In July of 2017, the Baltimore City Health Department received notice from the Federal Department of Health and Human Services that the grant period for our city's teen pregnancy prevention program would be terminated 2 years early. This amounts to a reduction in overall funding from $8.6 million to $5.1 million, which is a funding cut of $3.5 million. This cut is shocking and unprecedented. Congress authorized the funding, which is available. The grant period is 5 years, and there's no reason to terminate it early. The grant also comes at a time when we have made remarkable progress in reducing teen birth rates, with a 61% reduction in teen birth rates here in Baltimore City between 2000 and 2016. This funding cut means that there are 20,000 students in Baltimore who will no longer have evidence-based teen pregnancy curricula, creating a vacuum of critical health education for thousands of vulnerable teens. In addition to cutting evidence-based teen pregnancy curriculum that includes education on physiology and STD and HIV prevention, the funding cut also removes support to train teachers and build capacity for health education. Last year, we trained 115 teachers to deliver evidence-based teen pregnancy prevention programs. These facilitators ensured that 12,000 Baltimore City teens received this education in the 2016 to 2017 school year alone. The funding cut also jeopardizes our Teen Advisory Council, the Youth Advisory Council, I should say, which is made up of teens in the city who act as peer health advocates who share information about reproductive health. Participants in the program have given feedback on how what they get out of this is much more than health education. They also get training on how to get control over their lives and are empowered to make the best choices for themselves and their families. One participant told us, "Without this education, I likely would have been a teen mom and my future would have been very different." As a doctor and public health official, I've seen how much this evidence-based, science-based grant has helped us in Baltimore, and I'm deeply concerned about 3 areas. First, this cut will slash educational attainment and economic opportunities for our youth. Many studies have shown us that reducing teen births increases the ability of girls to graduate from high school and to have economic stability for themselves and their families. Second, this will increase cost for our city and for our country. There was a 2010 study that found that teen pregnancy and childbirth accounted for nearly $10 billion of cost nationwide. Third, this will adversely affect health outcomes for our most vulnerable mothers, children, and families. Teen mothers have a higher rate of giving birth to preterm, low birth weight babies who are more likely to have worse health outcomes. There are also health consequences to the moms themselves. I speak now not just as a doctor, but as a new mother. My baby son, Eli, is now almost 8 months old. And all of us moms and dads and families want nothing more than to have a healthy child. If we have a strategy that will improve health outcomes for our women and children, the last thing that we want to do is to hurt generations to come. So for those of us on the front lines, we don't see a number. We see the faces of our 20,000 students and 20,000 teens who will not receive the education. We see the effect on them and on our city's future. Thank you, Madam Mayor.
Thank you. Dr. Pat.
Thank you, Madam Mayor. Good morning, everyone. I run a national organization entitled Healthy Teen Network. We are based here in Baltimore City. We were also one of the grantees, therefore one of the plaintiffs whose grant was cut short by 2 years. Our focus was on developing an app that would be available to men and women, but primarily focused on young women across the country. We were adapting an app that had been proven effective. We were reaching out to the Hispanic population, African American population specifically. The loss of this funding means that we will not be able to test this app for the Spanish-speaking population, who in fact have the highest rate of teen pregnancy across this country. It also means the loss of a mechanism of delivery that is very much in concert with what young people are doing today in order to get their information. It also flies in the face of the reasons that we're given in terms of the data-driven aspects of what we do in teen pregnancy prevention. Along with Dr. Nguyen, we promote using evidence to decide what to offer to young people. And stopping these grants that are all evidence-based, that are building a base of evidence for this work to promote an ideology that is not evidence-based, goes against the grain of all that we believe in and we think is very harmful to the young people in this country. And that's why we are joining this suit.
Thank you.
Doctor, can we have your name, please?
Patricia Paluzzi,
Could you spell your last name?
Paluzzi. Mm-hmm.
Okay. I didn't know whether our representative from, but our city solicitor.
We are very pleased to join with Healthy Teen Network as plaintiff in this case. What we're asking for is modest, but as you heard from Dr. Nguyen, very, very important to the young people in our city. The court recognized the importance and the timeliness of this request, and so we'll be in court tomorrow on a very expedited basis before the federal district court. And as I say, what we're asking for is not an award of the grant. The grant's already been awarded. Nor are we asking that the court order the government to pay the money. What we're asking for is that the court order the government to process our application. And we are confident, because we've shown success and we continue to show success, as you've heard, that the court will see fit to terminate the government's termination of our grant on the basis that it's arbitrary and capricious and not in accordance with law. So we look forward to appearing before the court tomorrow and making our arguments.
Any questions?
Yeah.
Judge,
Can you explain what you mean by,
terminate.
yeah, well, no, but before that, when you said asking the government to process the application, what application exact? So the application for the grant, I thought that was already done because you already got.
For the renewal. It's an annual renewal,
Okay.
and we've been renewed for 2 years. It's a 5-year grant. First year was very successful. We were renewed for the second year, very successful. We were renewed for the third year, very successful. And now the government says, okay, no more funding. That's what we're challenging.
So, are you appearing in court tomorrow to argue this?
We will be in court tomorrow, yes.
And is this a motion? What is it?
It's actually a couple of cross motions. We're hoping that the judge will be able to resolve the case once and for all by the end of this month.
And this is in federal court?
In federal court, yes, at the Garmatz building,
And,
at 2 o'clock.
and are we testifying, or are we giving, I mean, is Dr. Nguyen testifying on behalf of the grant? Or what's
She will be available to testify, but we think that what's in the papers already will be sufficient for the judge after argument to decide the case. But if the judge wants to hear testimony, we'll be prepared to present that testimony.
And can you clarify, when you guys said you were filing the grant, or so when you were filing the suit, it took you a little bit because you were negotiating as far as what you were going to be asking the government for, is that correct?
No.
Why did it take a little bit to figure out to actually file the suit?
We've been working with the lawyers on the other side who've been very cooperative in the scheduling and in the briefing and so forth. So they've agreed to the expedited treatment of the case by the court that we requested.
And that's because funding's running out and then you need it for this upcoming fiscal year?
Yes.
So Dr. Nguyen, what kind of explanation did you get for the freezing of the grant in the first place?
We received no explanation. Actually, the letter that came wasn't a letter saying that your funding is cut. It was in a routine award letter that simply stated that the end of the grant was going to be 2 years earlier. There was no explanation provided, despite numerous phone calls, emails, and written requests for that reason.
I mean, have you been able to make any sort of educated guess, either through court filings or to figure out what exactly?
We hope to get some answers tomorrow.
Okay.
Do you suspect that they have a different view of how to prevent teen pregnancy than what's been in your you might be able to address that?
Doctor.
We highly suspect they have a very different view of how to prevent teen pregnancy than we do. Yes.
And in your experience, there isn't a way that's expressed in many states, they say abstinence. How effective is that compared with what's been tried here?
Right, well, that's the issue, is that, as Dr. Nguyen said, as I said earlier, we go with what the research shows, and the research is on the side of comprehensive sex ed, that young people need to understand how to protect themselves, how to make good decisions about whether or not to engage in sex, how to protect themselves, where to get protection should they decide to do that. And that's not the kind of education you get with abstinence. And there are no data that say that that encourages sex, that just supports healthy decision making. So and good comprehensive sex ed also includes the message of abstinence. It doesn't encourage sex, it includes that message, but it also prepares young people for whom a different choice is, that they're making a different choice.
But you don't think it's just a federal government being stingy issue? Do you think it's an actual philosophical choice on their part to change the method of what they like to do?
I think that I think we have to, I think I can't speak to that, actually. So I think we have to wait and see what happens tomorrow. There are similar cases being heard today in Washington because there are 3 law firms representing about 9 different clients about this same issue, filing across the country. So one case is having a hearing right now, as we speak. Public Citizen, representing 4, I believe, state-level grantees, are in their hearing now, and ours is tomorrow.
Is it Dr.
Paluzzi.
And what's the name of your organization?
Healthy Teen Network.
Have there been other lawsuits or hearings from other states besides the ones in DC that have already happened?
No, the
this
first
is
ones are
the first
happening
ones.
right now.
Gotcha. Are you hopeful that based off of those, this might be speaking too much,
Speculation.
but are you hopeful that based off of those, you're hoping for a positive outcome from that?
I think that my understanding of the law, which is about this big, is that, the judges are different in their opinions and their interpretations of things. I think that the lawyers are hopeful they'll learn something today. I don't know that they would predict our outcome based on what they hear today.
And those same lawyers from Healthy Teen Network will be here tomorrow.
That's correct.
Gotcha.
Okay, any more questions?
Thank you,
All
Mayor.
right, thank you. Okay, I have a few minutes.
Can we keep the solicitor for a second?
Sure.
Okay.
Any questions for me? You want to
Well,
solicit?
really for both of you.
Okay.
The Board of Estimates today approved a $90,000 settlement in a lawsuit that was filed as a result of an incident involving officers in 2015. We think that that's the first such settlement this year, other than an accident case. Has the rate slowed of lawsuits being filed, settlements? Do you know? I mean, you guys handle these in your office.
Let me just say we've won a couple of cases this year
Case that did not settle?
that did not settle. Yeah, we've got a couple of jury verdicts this year. But it's variable, of course,
But you
over
have to make
time.
that decision based on facts of the case. and
Facts of the case.
Whether you should even go to court.
Exactly.
Where in this case,
Every case is decided on its own facts in the law, of course.
So there's no trend you're seeing where misconduct lawsuits against the police are going down? And that's-
No, I would not say that any such trend exists.
So in this case, there was a verbal argument, a physical altercation between a potential witness and police officers. I mean, what should have happened here?
Well, hindsight's always 20/20, and we are continuing to do the training called for by the consent decree of all of our officers.
I mean, based on what you've seen, based on the facts of the cases, I mean, did police needlessly escalate the situation?
We are focused on de-escalation in the training that we're doing going forward, and that's our focus. Going forward, how do we de-escalate? How do we reduce the need for arrests? And how do we engage in community constitutional policing? That's our lodestar.
These settlements or these lawsuits, do they get seen by the Civilian Review Board, or do only some of them get seen by the Civilian Review Board?
Well, the lawsuits are
I mean,
long after
sorry,
the investigation.
The investigations when they come into the police department, are they also being seen by the Civilian Review
Yes.
Board?
Yes. The Civilian Review Board actually conducts investigations.
Right, but
On its
they-
own.
They have a specific amount of, they have a specific category of investigations which they can do.
Yeah.
So we're saying all of these,
But a use of force situation is one that the Civilian Review Board can look at, either on its own or by referral. Okay?
Mayor, what kind of confidence do you have in the independent review board that starts its work on the Suter case tomorrow, I believe?
Well, let me just say that the appointment was made under advice to the commissioner, and I have confidence that they will take a deep look at this case, which is what we want.
Madam Mayor, when did you realize that there needed to be a board like this or some sort of outside, but besides the FBI, an outside perspective on this case?
That decision was made by the police commissioner. I think I mentioned earlier that we called for an FBI investigation. We had conversations with Souter's wife recently. I think I mentioned that to you all the last go-round, and he wanted to get another independent eye on this investigation, had that conversation, and so he went about the business of setting up this investigation.
You have new lights being put up around the city, correct? And I actually put in a Maryland Public Information Act request to see maybe a map of where all the lights currently are or where the new lights are going up. When might you have that information coming out and available? I know someone in your office said it was going to be coming out, but they couldn't show it to us yet.
That's the Department of Transportation, Michelle Bouchou.
Right.
We'll make sure that she, that's a question you really should ask her.
Right.
We're looking at the city in terms of, we're still looking at the entire city. They all won't even be done until the end of 2019. And so we're also changing out all of the light bulbs in the city to LED lights. And so I think she's working on a schedule for that as well. So when she comes back again, I think you should ask her.
You will be releasing kind of like a map or a database of where all these lights
Where all the lights, the new lights, but all of the lights in the city are going to be changed out to LED lights so that we can brighten up the city.
Madam Mayor, what was your thought process behind supporting the styrofoam ban in the city over objections from restaurant owners who said it would be an unjust cost to them?
Well, I think, first of all, part of the styrofoam ban gives our restaurateurs and those who are using styrofoam foam a period of time to transfer over to more recyclable, better products. And I think that if you were to hear from many of the restaurants and so forth, that they feel that we've been giving them the proper timing.
And have you officially signed that?
There will be a ceremonial signing tomorrow.
Okay.
I think it's Thursday. Is that Thursday? Yes, at 2 p.m.
Do you think that we ought to change the dates of Lake City?
Do you think the date should
To
be
get the warmer weather.
the warmer weather?
There's been some discussion.
I think initially, part of it is the time, the availability of hotels and so forth, because so many people are coming into the city. I think Saturday, when we kicked it off, it was just masses of people downtown, and still masses of people in the downtown area. I think that the committee that's working on Light City would have to make that determination. Maybe we need to have better conversations with the weather.
Yeah, Saturday was great. but
Saturday was awesome. Friday was awesome, and then boom. But it's going to get up to 60 today, and it's supposed to be close to 60 throughout, so should not be so bad for Light City. I'm predicting sunny, in the 60s, walkable, we can run. Yeah, so we should be okay. All right, so I hope everybody gets down to Light City and enjoy yourself. Thank you.
Thank you.